Hi, my name is Dylan Flynn, and this is my term project for Healthcare Administration 416, the Financial and Quality Analysis for Indiana. My role is a data analyst for Indiana. The purpose for my analysis is to compare Indiana versus the national. I'm analyzing Indiana's DRGs by discharge, DRGs by average length of stay, top 5 hospitals by discharges, and the top 5 DRGs for hospital for special surgery. The tools I used are Access and Microsoft Excel. The source of the data I used is CMS 2018 data. National versus Indiana versus in average length of stay and quality metrics. Average length of stay can be used to evaluate the quality of care provided. Average length of stay measures the average number of days that patients spend in a hospital. This is important because it helps provide insight into the balance between providing high quality care, ensuring operational efficiency, and managing costs. Average length of stay is determined by dividing the total number of inpatient days by the total number of admissions or discharges during a specific period. Cost per discharge can be used to evaluate the efficiency and financial health of a hospital. It calculates the average cost incurred to treat a patient until discharge. Case-Mix Index is used to evaluate if the hospital is financially and operationally equipped to deliver high-quality care for diverse patient populations. CMI is important because it measures the complexity and resource intensity of a hospital's patient population. CMI is determined based on DRGs and their relative weights divided by the total number of discharges. CMS monitors readmissions as a measure of hospital quality and patient outcomes. Patient survey from the CAHPS is a measure of patient experience and satisfaction with care. Here we see the national versus Indiana. Average length of stay percentage between Indiana and the national metric is 3.91%. Indiana has an average length of stay of 6.01, while the national metric has an average length of stay of 6.25. So my state has a lower average length of stay. Right below it, we see the calculations I did to get to 3.91%. The cost per discharge difference between Indiana and the national metrics is 25.25%. Indiana has a cost per discharge of $65,916, while the national metric has a cost per discharge of $84,959, meaning that the national metric is higher. And right below it, you see the calculations. My state has a higher CMI than the national. Indiana has 1.49, while the national is 1.48. Indiana having a higher CMI than the national can have many reasons, including requiring more resources to treat patients efficiently. It receives higher reimbursements, and that they treat more medically complex patients. My state has a lower REDMIT than the national. Indiana has a REDMIT of 16.38%, while the national has 17.47%. Since REDMIT is a percentage of patients admitted to the hospital again after 30 days, Indiana has effective care coordination with a clear focus on preventive care while having a healthier demographic. My state has a higher patient survey than the national average. Indiana has a patient survey of 4, while the national average is 3. Overall, my state seems to be higher than the national in places where it's important. Here we see the top 5 state versus national DRGs by discharge. National data can help assess the health of Indiana by comparing the outcomes and the quality. Looking over the discharges, days, and average length of stay, you can see that the national metric is higher than Indiana. With lower discharges, it can be suggested Indiana has a lower prevalence of certain health conditions. Indiana is shown with lower hospital days, which can suggest more effective outpatient care. The average length of stay is very similar, which means it's performing similarly to other regions. The frequency of DRGs can significantly help a healthcare administrator anticipate both care and cost needs. This is because DRGs are used to classify hospital cases that are expected to have similar hospital resource use based on the patient's diagnosis, treatments, and conditions. Pie charts help with distribution companies since they are visually represented as part of a whole, which makes it easier to see how different segments contribute. Here's the analysis of average length of stay for top discharge DRGs, Indiana versus top national. A DRG not uncommon between Indiana and the national is DRG code 885. The Indiana average length of stay is 9.98, but the national average length of stay is considered not a top national for psychosis. DRG code 189 is also different from the others since the Indiana average length of stay is higher than the national average length of stay, while the others contrast this. From the analysis, we can see that some of the top discharge DRGs consist of respiratory diseases, which can indicate that Indiana is one of the states with the highest levels of respiratory illness. A lower average length of stay in a healthcare setting usually indicates better quality of care, since it shows that patients are discharged sooner due to effective treatment. Hospitals that provide high-quality care frequently manage to optimize resources, which will lead to shorter stays without compromising outcomes. I use the bar chart to analyze the top DRGs for average length of stay because it efficiently communicates comparisons and rankings. Each bar represents the average length of stay for a specific DRG, making it easy to identify which conditions have the longest or shortest stays. All right, here's the top 5 state versus national DRGs by average length of stay. When showing the top DRGs by average length of stay, the data typically focuses on resource-intensive DRGs. The average length of stay is a measure of how long, on average, patients in a specific DRG stay in the hospital. A higher average length of stay often correlates with more resource-intensive treatments, indicating a higher cost. We use a bar chart because it's easy to interpret the relationship between the DRGs and average length of stay, with the bars representing the average length of stay, allowing for a better understanding of the differences across the DRGs. And here we see the top 5 hospitals by discharges for Indiana analysis of REDMIT and CMI versus cost/discharges. The hospital with the highest discharges in my state is the Lutheran Hospital and is also the most expensive. The least expensive goes to the Adams Memorial Hospital. CMI stands for Case Mix Index, and it's used in healthcare to reflect the resource intensity of the patients treated at a hospital. It's calculated based on the types of diagnoses and procedures patients are receiving. Parkview Ortho Hospital has the highest CMI, while Adams Memorial Hospital has the lowest CMI. A high readmission rate signals problems in the quality of care, patient management, or healthcare system inefficiencies. Adams Memorial Hospital has the highest readmission rate, while the orthopedic hospital has the lowest readmission rate. Lutheran Hospital has the lowest patient satisfaction, meaning there are many issues, including effectiveness, timeliness, and communication. The highest patient satisfaction is a mix of Adams Memorial Hospital, Parkview Ortho Hospital, and the Orthopedic Hospital, which means these hospitals gave the patient a positive experience with their care, treatment, and hospital environment. Here is the top 5 hospitals for Indiana analysis. Yes, there is a correlation between average length of stay and how expensive a hospital is, because the higher the length of stay is, the less the cost of discharge is. The hospital with the most favorable relationship between average length of stay and cost per discharge is Adams Memorial Hospital. The hospital with the least favorable relationship between average length of stay and cost per discharge is the Parkview Ortho Hospital. There is also a correlation between CMI and how expensive the hospital is, because the lower the CMI is, the lower the cost per discharge is. The hospital with the most favorable relationship between CMI and cost per discharge is DuPont Hospital, while the hospital with the least favorable relationship is the Lutheran Hospital. After evaluating the data, the only concern I have is the Lutheran Hospital. We see from the data that this hospital does have the most discharges, but this is due to the many hospital stays and 447,334,861 hospital charges. The hospital also has a hospital rating of 2 compared to others which have 3s and 4s. Right here is the top 5 discharges, DRGs for hospital for special surgery. The top 5 DRGs for hospital for special surgery compared to state analysis. One of the top hospital DRGs that is in common with the state is DRG code 467, which is the revision of hip or knee replacement with CC. This is because the other DRGs have to do with major joint replacement or spinal fusion. DRG 467, the revision of hip of knee replacement with CC, being one of the top 5 DRGs for the hospital special surgery, can be attributed to generating a higher patient volume for such a complex procedure. A program that the top facility specializes in that attracts a certain patient population is the one that deals with major joint replacement or reattachment. The 2 DRGs for a hospital for special surgery deal with that program's lower and upper extremities. The hospital average length of stay for DRG code 467 is very similar to the state average length of stay. The percent difference average length of stay for DRG code 467 is also different than the others by being in the positive with 1%. So for the conclusion, my future role is to be in radiology. Being in radiology, you act as an analysis and deal with a lot of analysis, such as the ones here. They analyze imaging trends across populations, contributing to predictive models for disease prevalence and progression. The top 5 hospitals in Indiana are Adams Memorial Hospital, DuPont Hospital, Parkview Ortho Hospital, the Orthopedic Hospital, and Lutheran Hospital. The patient ratings are high for all the hospitals except Lutheran Hospital, which has a 2. The top 5 DRGs for hospital for special surgery are DRG codes 470, 483, 467, 460, and 454. The top 5 DRGs by discharges for Indiana are different, being DRG codes 871, 177, 291, 885, and 189. For the top 5 DRGs by discharge, Indiana and the National both have the same top 4, but change at number 5, where Indiana has DRG code 189, pulmonary edema and respiratory failure, and the National has DRG code 470, major joint replacement or reattachment of lower extremity without MCC. Indiana has a lower cost per discharge compared to the National. For the top 5 hospital by discharges for Indiana, you can see that the top hospital, Adams Memorial Hospital, has the lowest hospital charges, while the highest hospital charges are Lutheran Hospital. Adams Memorial Hospital also has the lowest cost per discharge, while Parkview Ortho Hospital has the highest. For the top 5 discharge DRGs for the hospital for special surgery, DRG code 460 has the lowest total charges, while the highest goes to DRG code 470. The lowest cost per discharge is DRG code 483, while the highest is DRG code 454. Out of the top 5 hospitals by discharges for Indiana, the one with the lowest readmission rate is the Orthopedic Hospital, while the highest readmission rate is Adams Memorial Hospital. For the top 5 discharges for hospital for special surgery, the DRG code with the lowest readmission rate is DRG code 470, while the highest readmission rate is DRG code 467. A unique feature of my hospital is, as stated in the name, the Hospital for Special Surgery specializes in special surgery, and their top DRGs consist of major joint replacement or reattachments, spinal fusion, and hip or knee replacement. A concern that should be brought up has to do with Lutheran Hospital, because with it being one of the top 5 hospitals in Indiana, I expect it to have better statistics. Most of the data is higher than the other 4, such as hospital charges, hospital days, hospital discharges, and average length of stay. This could be due to many factors, including certain complex procedures, serving larger populations, or operating in high-cost environments. After looking at the analysis and data sets, it has made me even more excited to get into radiology, because I want to directly help patient care by contributing to decisions on surgical interventions, medication adjustments, or further testing. The analysis of follow-up imaging will determine treatment efficiency and progression of diseases. Here are my screenshots, here are my references, and here are my resources. Thank you for listening.